Hi, I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also a diplomate of the American Association of Integrative Medicine. I'm the author of this book, Growing Young, and I'm the clinic director of Mounds View Chiropractic in Mounds View, Minnesota. Today I'm here to discuss with you thyroid disorders. I actually got into working with thyroid patients through working with peripheral neuropathy, actually. With my chiropractic neurology background, we work with patients that have numbness, tingling, burning pain in their hands and their feet. And one thing I found with many of these patients was that they had underlying thyroid disorders. This was something that, as I investigated further, it was something that we had to support in order to get these patients' nerves healthy again. And so I studied under a Dr. Karazian to identify and understand how to better support patients that have these thyroid conditions. And as a result of this, I realized that thyroid patients are probably one of the most mismanaged patient populations that I've seen. I continually see women and men in my office who, although they've been put on Thyroid or levothyroxine or Armour, they're continuing to suffer with all the same symptoms that they originally had. And it's an extremely frustrating thing. They're not able to lose weight, they have depression, they have fatigue, all of these things that are really impacting their day-to-day life, but their lab tests are normal. And then on the other hand, we have other patients who come in who can't lose weight, who have no energy, they're depressed, and they say, I've been in, I've had my thyroid checked, and every time I have it checked, my tests are normal, and they tell me that there's nothing wrong. And today, that's what I want to put an end to. I want to help you understand, some of the flaws and some of the ways that we look at some of the testing and how we can better evaluate you to find out what other underlying processes might be contributing to some of the symptoms that are occurring and how we can better support you and get you back to feeling like you again. And so the very first thing I want to tell you is that our approach is going to be different. Our approach is definitely unique, and we take a very, very comprehensive approach in managing and supporting patients that have thyroid complications or thyroid disorders. We're going to support you both neurologically and metabolically. The metabolic side of things, you probably understand why that needs to be supported as your thyroid is part of your metabolic system. But on the neurologic side, you might be saying, well, why does my brain have to be supported in order for my thyroid symptoms to get better? Well, many of your thyroid symptoms are actually neurologic symptoms if you think about it. So chronic fatigue, depression, anxiety, brain fog, memory loss, these are all brain changes. When you have any type of underlying thyroid disorder, it's going to affect the health of the brain. And so in order to really get your symptoms managed and get you feeling well again, we have to address the health of your brain. And we're going to talk on that in a little bit here. The very first thing that has to be done when we work with a thyroid patient is we have to run comprehensive lab testing. The one thing I can tell you, and this is where the ball is dropped the most, is that we get small little thyroid panels, we get small amounts of lab work done here and here that don't really tell us enough information as to what's going on with your individual case. And so it all starts with the metabolic panel. The metabolic panel is a blood panel where we're basically looking at you from head to toe, identifying any areas in the body, in the physiology, that could be impacting the health of your thyroid or other functions within your body. And so the metabolic panel will include a complete thyroid panel where we're looking at an exhaustive list of thyroid markers. I can tell you, you're just looking at your TSH alone is not enough to identify what kind of thyroid dysfunction you have. A TSH is enough to tell you if you're hypothyroid or hyperthyroid. So if your TSH is above the lab reference range, which is typically around 5.5, you're going to get labeled with hypothyroidism. Hypothyroidism is where you have too little thyroid hormone, and it's going to be categorized by symptoms of depression, lack of motivation, chronic fatigue, cold hands, cold feet, weight gain. So these are some of the classic symptoms. On the other side, if your TSH is really low, you're going to get diagnosed with Graves' disease or hyperthyroidism, where you're producing too much thyroid hormone. And this is indicative of a condition, or some of the symptoms of this condition would be, for instance, anxiety and an inability to gain weight. You might have night sweats, insomnia. Okay, and so these are some of those kind of symptoms. Now, regardless of which side, you may see, when I list off those symptoms, you may say, well, I have symptoms of both. I get some anxiety, I get night sweats, but then I have chronic fatigue during the day, I have depression on some days, and anxiety on other days. And this can categorize a condition called Hashimoto's disease. Hashimoto's is an autoimmune disease where your immune system is actually attacking your own body. And we're going to be talking about that in just a few more minutes, so we'll come back to that. But when we run a thyroid panel, a TSH tells you whether you're hypo or hyperthyroid, but it doesn't tell you where the thyroid dysfunction is coming from. It doesn't tell you if you have Hashimoto's, if it's this autoimmune process. It doesn't tell you if you have a pituitary gland that's sluggish and is not working and that's what's causing your thyroid symptoms. It doesn't tell you if it's your gut, where you have a gut issue and you're not able to convert T4 into T3, so you have thyroid symptoms. And so we have to dig deeper and look further to basically be able to identify exactly what is causing your thyroid dysfunction. And so our panel, we're going to look at TSH, we're going to look at T4, at T3, at your free thyroxine index. We're going to look at free T3, free T4. We're going to look at your TPO and TBG antibodies. These are how you identify Hashimoto's disease, which is that autoimmune reaction. You have to run comprehensive testing to identify this. Now, in addition, one of the common things I hear is that I have all these thyroid symptoms, but I'm always within the lab reference range. Well, what I can tell you is the lab ranges, when we look at lab ranges, they're very, very wide ranges. So if you're looking at a TSH, a normal lab range will be about 0.8 to 5.5. So if you're within that range, they're going to consider you normal. Our reference range that we use is what's called a functional range. It's a narrowed range that basically identifies and says if you're in good function, if you're healthy, you should fall within this range. And so our reference range that we look at is about 1.5 to 3.5. And so if you're in that range, we would say you're in optimal range. But if you're above that, but not quite outside of the lab range, you may still show characteristics of hypothyroidism, but just not have true full-blown hypothyroidism at this point. And so there's things that can be done to start supporting the health of your thyroid now and hopefully prevent full-blown hypothyroidism. And so that's one other way that we look at blood work that I think is a very important distinction. Now, in addition to the thyroid panel, we have to look at signs of anemia. If you have any type of anemia or underlying anemia, again, you can't get oxygen into your cells. Your cells need oxygen to survive. And so if you can't get oxygen into the tissue, you're not going to get better no matter what we do. And so we have to look at anemia. We have to look at your blood sugar, make sure your blood sugar is very tightly regulated. We want to look at inflammatory markers. Okay, your thyroid panel, I already mentioned your thyroid panel, your cholesterol, your lipid panel. Okay, we want to look at your immune system cells. We want to find out, are we seeing signs of any type of lingering infection, parasites, bacteria, viruses, any type of infection that could be causing poor performance in your body. And so with the metabolic panel, we're basically going to be covering you from head to toe, identifying all the different areas. And it's very, very thorough. In addition to this, we have to start looking at your immune system. I already mentioned to you that the #1 cause of hypothyroidism in America is Hashimoto's disease, where we have this autoimmune attack against our body. 70% of your immune system is in your digestive system. It's in your gut. And so it's very important that we run testing to check the health of your gut. And so the very first thing we have to do is we look at what is called sensitivity testing. This is a blood test as well, where we're looking to find out, do you have foods that your body is reacting to? Are you intolerant to these foods? And this can be gluten, dairy, soy, yeast, eggs, corn, and many others. And so we have to dig deep and look at these different types of food reactions that could be perpetuating an abnormal immune response. If you're eating a food that your body reacts to, every time you eat that food, your immune system gets triggered. And if your immune system is attacking your thyroid, it's understandable how that's going to impact your thyroid symptoms, right? In addition to looking at food sensitivities, we also have to look at the gut for underlying infections. So we do a stool ecology profile where basically we're looking to find out if you have any type of parasite, bacteria, fungus, yeast overgrowth, anything that's, again, perpetuating this immune attack within your body. And so very, very important to look at these key pieces as far as what could be driving this thyroid dysfunction. In addition to looking at the gut health, we have to look at what's called the adrenal stress index. The adrenal glands play a very, very important role in thyroid function as well. We already mentioned how the pituitary gland releases TSH, which is what tells your thyroid to release thyroid hormone. Well, the adrenal glands have a direct feedback loop with your pituitary gland. And so if your adrenal glands become sluggish, your pituitary gland can in turn become sluggish as well, to where it doesn't secrete enough TSH, and so you get thyroid symptoms. This would be a perfect example of a patient why you may have thyroid symptoms, but your lab test, your TSH, is still in a normal range, because it's not a thyroid problem, but your pituitary gland is leading to less optimal or suboptimal thyroid function. Now, in addition to looking at this loop as far as the adrenals go with the thyroid, we also want to investigate the adrenals for their own reasons. Because the adrenal glands are your stress glands. So anytime your body is under stress, it's your adrenals that have to respond. And they respond by producing a hormone called cortisol. And cortisol plays a key role in many things. But one thing it does is when you have increased cortisol levels due to any type of stress on your body, whether it's a food, whether it's an infection, whatever it is that's driving it, your cortisol level goes up, your ability to burn fat decreases. Your body is going to start increasing fat stores, and so weight becomes a major issue. Cortisol also drastically influences your circadian rhythms. So you may be, if your cortisol rhythms are skewed throughout the day, you may have insomnia at night followed by chronic fatigue throughout the day. And so it's extremely imperative that we look at your adrenal glands. Other things that the adrenals do is they release precursor hormones called DHEA and pregnenolone. These are precursor hormones to progesterone and testosterone downstream. And so if you have deficiencies in your ability to produce DHEA and pregnenolone, you may have hormonal imbalances where you get fatigue, moodiness, irritability, hot flashes, many of these symptoms, which also kind of mask many of the thyroid symptoms. And so adrenal function is extremely imperative, and we have to look there as well, because even if we support your thyroid, if you already have adrenal dysfunction, you may be unable to lose weight if we don't get your adrenals supported as well.